Next is we have the drug detection. So this is most specifically useful sa mga may drug dependence or yung may mga substance abuse patients. So, sa mga nakapag-work na before, no, kung nagpa-drug test kayo, ito po yun, drug detection. So, anong ginagamit natin dito? We use urine specimen to detect unknown drugs. Okay? So, kung makikita nyo, nag-fill up tayo ng form dito, tapos we supervise or we witness how the patient gets the urine sample, no? Because we want to make sure that the urine being used is the urine solely that came from the patient's urethra. Okay? Kasi usually ginagawa para hindi mahuli, gumagamit or hinahaluan ng water. Kaya hindi rin natin hinaalaw na may water na may water na kasama sa loob kay pag-iihi yung pasyente at magko-collect siya ng urine sample. Other term dito is yung toxicology screening. Okay, your nursing responsibilities again is to explain the procedure, and we want to make sure that we are getting the informed and written consent. Okay, remember that this is a sensitive issue since we are dealing with substance abuse or drug dependence. So we want to make sure that it is we are doing this in a legal way or in a legal manner. That's why we want to make sure that informed consent, written consent is secured. Okay, and sabi ko rin kanina, we have to witness the procurement or the collection of the urine specimen to make sure that the protocol is being followed.